Hi everybody. It's been a while since I made a video. Actually this video might be one of the most important I ever made. And I know I called it Revolutionary New Treatment, but I think you'll recognize the treatment right away. Maybe a new approach at doing something we already do for some of you. For some of you makes perfect sense. But follow along with me, see what you think. Okay, Miss Johnson, it's time for your breathing treatment. Let me unhook the flow meter, put it on 8, because if I don't unhook it and put it on there first, it's going to pop off. Okay. I've already checked your pulse ox and it was fine and everything's okay, so I'm ready for you to do your treatment. I'm going to put this on continuous. Alright? Alright, I'll be back in a couple minutes. Take it off of you. Alright, I'll be back to see you another 4 hours.
Thank you.
Now you'll notice from that clip that we're using the Aero Eclipse Nebulizer, which has 3 advantages. Number 1, it's breath actuated, so that it doesn't waste the medicine during the expiratory phase. Number 2, the manufacturer states it has better particle size, more particles in the effective range, that 2 to 5 micron range that reaches the bronchioles. And number 3, I think it has lower dead volume than the other nebulizer. But it's supposed to be such a better nebulizer. It is more expensive, but it's supposed to be such a better nebulizer, and they have studied this, that it does a more effective job. But I have something else that'll make it even more effective. Hey, welcome back. Today I'm going to try to make the argument for you specifically about medication delivery, that a nebulizer given properly, and by properly I mean what Egan's tells you, which is slow and deep with an inspiratory pause. Properly done, an aerosol, 1 minute of an aerosol treatment is as effective as 10 minutes of a treatment that is done, say, where you don't ask the patient to do anything. That's the kind of argument I'm going to make, and I'm going to use this theory to support my argument right here. Let's take a look at this. Right here on the x-axis here, I have rapid shallow breathing index, which is defined as respiratory rate divided by tidal volume in liters. So let's take, for example, you had 20 breaths per minute and 400 tidal volume, then you'd have a rapid shallow breathing index of 50. Okay, down here we have somebody I've asked to take a deep, slow, deep breath with an inspiratory hold, and they're breathing a slower rate at 6, of course, because of their IE ratio. They need plenty of time to expire, but their tidal volume is something like 1500. So down here we have a rapid shallow breathing index of more like 5. Okay, properly breathe, that you get an enormous amount of deposition in the place where it needs to be at low RSBIs, at these high tidal volumes and low rates. And so now, by my graph, let's compare the person. We just stuck a mask on them. We didn't tell them. We gave them no instruction on how to take the treatment, and they're doing a 400 tidal volume at a rate of 20. I would say that it was 10 times less effective than if I had told them to do that. And I think the data bears this out. Let's say you don't want to ask your patient to take a deep breath. You don't want to give them any instruction at all. How long would it take of this treatment to be, and I have an audience here, I'll ask them, how long do you think the treatment would take, or how much time would it take to be as effective as that? How many minutes? Say this is a 5-minute treatment. 10 times that, right? So it'd take about 50 minutes or an hour. So really, a 5-minute treatment breathed effectively is probably more effective than an hour's worth of treatment breathed ineffectively. But what I'm trying to do is I'm trying to make the argument that if we do the treatment right, we can do it much more quickly and much more effective. I think we can do a treatment in under 5 minutes. I think the treatment can be effective. But I think we also have to appreciate that if our patients are in a state where they're not able to follow instructions, we should consider giving them longer treatments to compensate for that. Because if we can't control these factors, the only thing left that we can control is the amount of time we deliver the respiratory therapy. Now, we've noticed for some time that people who come in and already have advanced state of bronchospasm, that even when we do get them to breathe, because of the state of their airways, we can't bronchodilate them very effectively. So we already know to put them on a continuous neb that maybe lasts for an hour, 2 hours, 3 hours. So we already know that. So I think this is an extension of that. Also, look at MDIs. Studies have shown that metered dose inhalers are just as effective as a nebulizer treatment if done properly. How do we ask our patients to take their metered dose inhalers? We ask them to take it, breathe it in slow. In fact, the spacers that we require that the patients use have a flow rate indicator on it that whistles if you're going too fast. So you breathe slow, deep with an inspiratory pause. So I think you can deliver, so that the metered dose inhaler is proof that you could literally deliver the entire dose in 2 breaths. Because if we run around and stick a mask on somebody, no instructions, go to the next room and stick a mask on somebody, we may think we're getting a lot done and being productive, but we're not being very effective. If we stayed in the room and did a few minute treatment and did it right, we'd be more effective and could move on to the next patient quicker. Now, with those points in mind, let's try to do it right. Hey, Miss Johnson.
Hi.
How are you today? Listen, I already checked your pulse ox, it's fine. And it's time for your breathing treatment. Now, I noticed they have your treatment set up with a mask. You know, I found that if I get you to sit up, take slow, deep breaths and hold it, that you'll get a lot more of the medication. Can I go ahead and sit you up?
Please.
Okay, let me sit you up some. I want to sit you up as high as we possibly can, okay? Okay? Now, let me get you the mouthpiece out of the bag here, because if we do this right, you'll get so much of the medication that you only have to do it for 5 minutes or less. Okay. All right, and I'm going to put the nebulizer on breath actuated, so you'll only get the medicine when the nebulizer's running. It's not going to waste it.
Okay.
And you're not getting it. Okay, so let me go ahead and unhook the nebulizer. Let's put it on 8. Plug it in. All right, will you hold this now?
Sure.
Now you're going to put that in your mouth, and I want you to take slow. There's 3 things I want you to do. Slow, deep, go ahead, good, and blow it back out. Slow, deep, and try to pause at the end. Now I'm going to go ahead and listen to you while you do that. I want you to take slow, go ahead. Breathe in, hold it, and blow it back out, okay? I'm going to listen to you. That's good. You're taking good, slow, deep breaths for me. Perfect. You can breathe in a little faster if you want to. Does it seem to be coming on as you breathe in? Mm-hmm. Okay, good. All right. Great. All right. Are you able to sit up a little bit? Excellent.
No.
Okay, keep going. Take those slow, deep breaths and hold it. Well, you're doing a good job. All right, excellent. You sound pretty clear. Okay, so far we've been going for about 2 minutes. We're just going to do it for a couple of more. Okay, just to sum it up, I wanted to say 2 things, and that is that, number 1, you should evaluate the effectiveness of the treatment on your patient. Have some criteria to do that. Number 2, whenever possible, use concentrated medications so you can keep the volume of the treatment at about 1 cc's or less. All right, see you next time.